Therapeutic exercises are used for many different things. For instance, they can be used to increase joint mobility, to promote gliding of a tendon or nerve and prevent adhesion formation. Therapeutic exercises can also be used to assist with maintaining connective tissue mobility and affect scar tissue formation. Therapeutic exercises can also decrease edema. A lot of times therapists neglect that. They think that we have to use other types of treatment to decrease edema, but therapeutic exercises are also effective for decreasing edema. Therapeutic exercises can be used to increase strength and stability, improve fine motor and dexterity. Therapeutic exercises can be used to decrease pain. That's a hard one for most therapists because a lot of times we implement therapeutic exercises and often incorrectly, and therefore we increase patients' pain, but they can also be used to decrease pain. Therapeutic exercises can be used to improve joint and bone health as well as increase a patient's endurance. But most of all, therapeutic exercises are used ultimately to improve a patient's function. So the demonstration you can see here, I have the patient positioned for a short arc motion for flexion and extension. And once I've established their arc of motion, they'll move within that arc back and forth, holding the weight or holding just that position in a smooth, controlled manner. Next, we can see an illustration of horizontal abduction and adduction. Now again, as the patient moves into horizontal abduction, make sure that they do not move so far out away from their body that they're unable to control the motion, as this could apply some unnecessary stress on the glenohumeral as well as the acromioclavicular joint of the shoulder. So for instance, if we want to use the Swiss ball to facilitate increased active range of motion for the elbow, we can simply have the patient perform a Swiss ball roll on a table surface. So much like we do with the shoulder, instead of having the patient start with the hand placed already with the elbow in a fully extended position, we want them to start with their hand placed as close as they can to the front part of the ball, and then the patient will actively push the Swiss ball forward, trying to get a good stretch for extension of the elbow. Now, just as much as we're focusing on extension, we're going to have the patient come back into a flex position, and sometimes the patient will have to adjust their position to change. So for instance, we can get a little bit closer to the Swiss ball, therefore we can get a better stretch for extension, and then as we come back, we want to try to get as much flexion as possible. Now, for a lot of patients, we're not going to choose the Swiss ball roll to really target their elbow flexion, but it is an excellent choice for using for elbow extension. As with all exercises, we want to make sure the patient is comfortable, the target tissue is being affected, and that the stretch is maintained by the patient during the exercise. When we look at performing active range of motion of the wrist, we need to consider a few things. We want to make sure that we isolate the wrist extensors when we actually perform the motion. Initially, when you have a patient perform active wrist extension, the patient will often substitute by using their finger extensors, and you'll notice almost a clawing type motion as they move the wrist into extension. If you watch their fingers, especially at the MP level, you'll see the patient lift with the finger extensors to try to perform that motion. In order to correct this, we must isolate the wrist extensors. In order to do that, we need to place the patient in a fisted type position. For some patients, especially after distal radius fracture, they're unable to achieve a full composite grasp. So in order to do this, we also can use something like a foam ball and have the patient hold that and perform wrist extension. As they perform that motion, they're able to keep their fingers in contact with the ball and isolate the wrist extensors. If the patient lifts to perform the wrist extension and their hand opens, they'll actually drop the ball, and then you'll know that they're actually still substituting with the finger extensors. As the patient progresses, we'll replace the foam ball with something such as a foam roll or wooden dowel, which they can hold to perform active wrist extension. So we want to make sure that we isolate the motion correctly, and I never have any difficulty trying to find something new to use with my patients. The nice thing about having such a large repertoire of exercises is that you never come short of being able to tailor an exercise program specific to each patient's needs. Now I'd like to take the opportunity to give you some tips from the field and answer some of the common questions that we receive in continuing education courses. First of all, does it help to apply heat or ice before or after exercises? Well, let me answer that. Heat can be applied, but with caution. Heat applied for longer than 10 minutes can actually decrease muscle endurance, causing early fatigue with exercise. Due to this, if the goal of the exercise is increased strength, heat may not be indicated in order to achieve maximum results. If the goal of exercise is for stretching, however, or passive motion, heat could be beneficial by allowing the patient to have relaxation of the musculature and also prepare the tissue for a more effective stretch. If the goal of the exercise is to increase range of motion, heat is applied, the exercise should be following immediately after the heat is removed in order to achieve the maximum results from the heat.